Now, staying with the United States, there, like here, we're told we are living in an age of austerity. And if you think budget cuts in Britain are really biting, spare a thought for a moment for the citizens of the American state of Arizona. There, the governor has slashed spending so much that the state will no longer pay for organ transplant operations, even for people who may well die if they don't get a new heart, liver or lungs. Our Washington correspondent Sarah Smith has been to investigate what some doctors are calling death by budget cuts.
Christmas in the desert is a pretty big deal. People spend a fortune decorating their houses to celebrate the season of giving and goodwill. It's a shame the state government isn't feeling quite so generous to the poor and the afflicted.
Where does it go?
As I helped the Shepherd family hang their Christmas decorations, we do not mention the fact that Randy's been told he won't be getting a badly needed heart transplant. He doesn't want his son to know that without that operation, this might be his last Christmas. To save money, the state of Arizona has cut its funding for organ transplants. Nearly 100 patients, including Randy, who were waiting for operations, have been told they're simply too expensive.
I've gone through so many emotions. At first I was kind of upset, and I mean, because it's literally, here, we're going to give you your life, and then, oh, sorry, now we're not.
Being taken off the transplant list, for you, is this effectively a death sentence?
I don't see how it can't be. I think somebody's gonna die because of this, and possibly multiple people.
How did you tell the kids about being taken off the list?
The kids, well, they know, they pretty much, my kids know Dad's sick and Dad needs a new heart. They don't need to be wrapped up in the politics of it. To remind him.
Can you reassure them that you're going to be around while they grow up?
Not honestly.
Arizona, like a lot of American states, is facing a huge budget deficit. So everybody realizes they do need to make some pretty drastic spending cuts. But people here were deeply shocked to discover that nearly 100 patients who need organ transplants, people just like Randy Shepherd, are going to be denied that life-saving treatment just to save $5 million. Especially when $5 million is a tiny fraction of the $1.5 billion the state needs to save. Perfect donor organs don't arrive in hospitals very often, but they can save lives when they do. So doctors here are very upset that now, even if they do receive a perfectly matched heart, liver or pair of lungs, they won't be allowed to transplant them into patients who've been waiting years.
It's death by budget cut. It's impossible to predict the future, but I mean, we will probably see a number of patients die over the course of next year, particularly
patients who you could have saved.
That we could have saved, for sure, right.
We need these procedures.
Those very patients, backed by opposition politicians, are putting public pressure on the Republican governor to reverse her policy before it's too late for one of them. Governor Gov Brewer is a well-known right-winger, and she could reinstate the transplant funding with the stroke of a pen. But even when the federal government in Washington sent her millions of dollars in so-called stimulus funds, she refused to use them for the transplant operations. How many transplant patients in Arizona have to actually die before you're prepared to reverse the decision not to fund their operations?
That's a real difficult, unfair question in my opinion. Certainly we have made budget cuts. The bottom line is that Arizona simply doesn't have the money. And
it's only $5 million. You must be able to find it somewhere else.
I wish that, I've got a $1 billion deficit facing the state of Arizona. The bottom line is we simply don't have the money. I would suggest that people would go to the federal government and ask them to send us stimulus dollars to support these transplants if that's what they want.
They sent you nearly $200 million in stimulus dollars. Why can't you use those for the transplant patients?
$200 million. They were sent to Arizona, and they have been expended in a proper manner.
Next question, please.
But what do you say to people who say this is just a GOP death panel? What's happening to transplant patients here in Arizona has got nothing to do with Barack Obama's controversial healthcare reforms, because what's happening here affects only people who rely on the state for their health coverage, not people who've got commercial insurance. But there is a particular irony to all of this. During those furious healthcare debates, President Obama was repeatedly accused by Republicans of wanting to set up death panels, bodies that would decide who was to get treatment and who would be left to die. Now, that was absolutely not true at the time, but of course now in Arizona there are plenty of people accusing the Republican governor of setting up death panels of our own.
There you go. Ready?
Randy Shepherd has to sit down, even while he's playing ball with his youngest son. But that won't stop him working tirelessly to try and raise the money to pay for his transplant operation himself. But new hearts don't come cheap.
Nice.
How much money are we talking about?
The total for the procedure is about $600,000.
That's a lot of money to raise.
That's a lot of money.
Can you really raise enough money to pay for this yourself?
I will or I'll die trying.
Well, Sarah Smith reporting there from Arizona. Arizona resident Randy Shepherd talking to her.